Okay, good morning. We're going to go ahead and get started with this meeting for the Respiratory Care Program of Study Subcommittee. So let's start off with introductions. Let's start over there, please.
I'm Kelly Reynolds. I'm Kelly Reynolds, faculty at Collin College.
I'm Carol LaRoe, Department Chair for Allied Health at San Jacinto College.
I'm Don Holt. I'm the Program Director for Tarrant County College.
Araceli Solis, Program Director, Collin College.
Cynthia McKinley, faculty, Lamar Institute of Technology.
Michelle Trubenstein, Dean of Health Professions, Howard College, San Angelo.
David Henson, Program Coordinator, Angelina College, Lufkin, Texas.
Laurie Kurges, Program Director for Howard College, San Angelo, Texas.
Donna Mendoza, Program Director for McLennan Community College in Waco.
Erica Harrell, faculty, St. Philip's College.
Okay, thanks. And I'm Dwayne Hiller, Program Director here at the Coordinating Board for Workforce Education. Just, I guess, go over a few housekeeping items. As you may remember, we're being broadcast live, so make sure when you're speaking that the red light shows on your microphone, and when you're finished, you can go ahead and turn it off. But I'd like to welcome you all. Know it's been a while since we last met. Just a little bit about the building. We have restrooms about midway down the hall. They're labeled on the hallway. And we also have a kiosk with sodas and snacks by the front door, and takes cash and credit cards. We have Wi-Fi under the label Education Go Get It, and there's no password required. Also want to say, if you're participating in the lunch today, be sure to go ahead and put the $10 in your envelope and pass those down to the end of the row so we can collect those. If you need change, just write the amount on the front of the envelope and we'll get to the change when it comes back. And sure, we also have the, well, make sure you keep the receipts if you need that for your reimbursement. Is that okay? She'll come by and get them. Yeah, thanks for that. As I said, it's been a while, probably about a year since we last met, and through email, we've sent the proposal out for public comments, and we received those comments, and you responded to those. I've included some notes from our last meeting, which kind of shows the final. I guess first, if you want to just go over the minutes, and this was the November 16th, 2017 meeting. That should be in your packet. And let me know if there are any corrections or additions to be made. Okay. Oh, and also a little bit of news if you haven't heard. Brian Stewart is no longer at Tarrant County College, and so that's why he's not here today. Hopefully we'll be able to interact with him at some point in the future, but he's off, off to Florida.
Has everyone had a chance to review the minutes? I'll entertain a motion to approve.
I'll second.
All in favor?
Aye.
All opposed? So- Okay, motion carried.
Again, as I've mentioned, the next sheets show the proposed program of study that was sent out for public comment. And in addition, the course changes that were made. There are four courses that are highlighted there on the program of study, and these are the changes that were made to those courses, along with an additional course that's not in the program of study, but had some changes recommended.
May I speak? This respiratory home care and rehab in the discipline course, I don't remember actually voting on that one.
Right, and actually what we're, the next set of pages show like public comments, and that's included in there. So I guess the main thing we're going to be doing today is looking at the comments and seeing things like that, the things that shouldn't be in here, and maybe things that we can take out to address some of the comments.
Okay.
So yeah, we will address that. And
Can I bring something to our attention here on the, do I need to press this? Oh, it's on. There is some overlap between Introduction to Respiratory Care and Procedures 1, Fundamentals 1. Are those, we combine Procedures 1 and Fundamentals 1, correct? But yet we still have the same overlap of vital signs cardiopulmonary assessment between Intro and Procedures 1. So do we need to define if it needs to go in one or the other, or we're going to be teaching it twice in the same semester?
I think that could be my personal opinion is that could be redefined. What would be, if we're requiring intro?
Yeah, if
then
we're
we should-
requiring
it's
intro.
going to be intro and what's going to be in respiratory care procedures 1 and 2.
And
I
I
agree.
guess one thing I want to point out, and then you can probably consider, usually like an introductory course, and the sentence is, identify the respiratory therapist role in performing basic vital signs. So it may not necessarily be the actual skill, but rather just the introduction of what your role, the role of the therapist is. So that's, I mean, if you think it's still confusing, I mean, if they want to keep it in, I mean, if they want to, if we take it out, if we want to edit the course, and we can take that out, and people can still include it in the course, if,
I just think it makes procedures 1 heavy if we're going to put all of that into one course, content-wise. And it'd be almost easier to just split it up, especially if they're courses that are taught in the same semester. So you can also teach as well, teach the role, because the role takes 2 slides.
2 seconds.
You know, and then teach them how to do it at the same time. So, I mean, it's a thought, because I've run into this, because I used to have intro, and we'd be teaching vital signs and introduction, and then we're teaching in fundamentals 1, and they're like, well, we did this already. And I was like, well, let's get rid of it.
Your intro went on at the same time.
Procedures 1.
Procedures are. They do. Vital signs up front. Right. When
Right.
they come to us,
Right.
we might brush over it and give them problems that they already
So is
know.
it,
I agree with you.
is it almost like in how some colleges have the, what is that, the HSRT?
Like a health professions
Yeah, that
course.
health professions thing. So, and that's the way I've looked at it. And some schools, I understand that they have it as prereqs, but sometimes intro is a full online, and how do I know that? How do I know that they know how to do a vital sign? I don't know. I mean, yeah, I mean, it could be like Dwayne said, the skill in fundamentals 1 and the, I guess, memorizing the normals in intro. Not everyone does intro as a prereq. So, I don't know. I mean, and I see it. I guess it just comes down to how people decide to present it.
I guess if they're doing competency evaluations in procedures 1 or fundamentals 1, and they're doing vital signs as part of their competency evaluations for treatments, that could be construed as it's being, included in the course.
Interpreted, yeah.
Yeah.
They learn it in intro, they get checked off in procedures during a checkoff. Yeah, and then we do it again in clinical, because we do a
Right.
preclinical.
We do too.
So,
They don't get the clinical software until
it's how I present it to my,
So are we saying leave it in both like we have it, or did we want to make a change?
I mean,
If you're given therapy in procedures 1, vital signs is part of it. And we all agree with that. So, I mean, it's not like it's going to be excluded. It's going to be covered in some form or fashion. Whether it's covered again, it's probably necessary, right? Assessment, you're going to be assessing since the time you start, right? So I would leave it in.
Okay, so are we all agreeing to leave the introduction to respiratory care as written, as well as the combination of procedures 1 and fundamentals 1 as written on the pages we have here? Is that what we're agreeing to?
I'm for it.
So the first listing of procedures 1, this is how it will be? With the red highlighted, that will actually be how it would actually be worded? Okay.
Right, this is how the new combination.
Right, and then the fundamentals 1 is just there for reference. It just shows what you took out of the fundamentals 1 course and added to the procedures course.
Okay.
So just the procedures course as edited there will show up.
Right, and fundamentals 1 will go away completely, correct?
Right.
Looks good to me.
Does everyone teach bronchial hygiene in the procedures 1 or fundamentals 1? I had previously done it in 2. Okay.
We did it in 2, but see where it can fit into 1.
If we get rid of the duplicate
Yeah.
vital sign stuff.
Okay, and I think what you're looking at, yeah, vital signs is under fundamentals, but the,
Okay, I think that's
Oh. Oh, it was taken out of procedures 1. I'm just kidding.
right, okay. Right, the new course.
okay.
Yeah, and I'm glad you pointed that out, because,
This one went away, yeah, we took these things out of this one, moved them up to this one, and keeping this one.
So this one will go away.
Right, this, we have it, so I think.
It's all going to this.
Sorry.
okay, I'm glad you,
In the new respiratory care procedures 2, are we on that yet? Or are we just kind of throwing stuff out? I have a question about it deals with concepts of mechanical ventilation, but at the end of the course outcomes, it's initiating mechanical ventilation. I personally think initiating mechanical ventilation actually needs to be in a mechanical ventilation course.
I remember talking about that, and I was thinking that we left or rewrote it that way because some schools actually start teaching mechanical vent at the end of this course. And I think most of us with IPPB or, positive pressure, we kind of considered that initiating mechanical vent. Because I introduced that, and I have fundamentals too, but not anything really beyond that in fundamentals too. But I remember having a conversation about it. I don't know
Right.
if that
I'm just
helps. but-
curious as this initiate mechanical vent might be interpreted as actually setting up the vent, putting somebody on a ventilator. And I'm not sure about the wording, maybe.
I mean, it could be construed as non-invasive ventilation as well if you're doing
agree.
BiPAP or CPAP in that semester.
Yeah, and that's when I
Yeah.
At the end of that semester, I do BiPAP and CPAP, so. So maybe do we need to clarify the wording?
We start them on towards the end of that semester. They may not necessarily put them on the event in the hospital. They're with instructors, but about graphics, about how does it work as output. What do we treat it as all of these different variations. And it's hard to get by if they don't twist everything.
Could we,
We've only
sorry.
got 5 semesters.
Could we say introduce mechanical ventilation or foundations of mechanical ventilation? I do understand what you're saying, Cynthia, because initiate does sound like you're going to place someone on a mechan.
Right.
So maybe like a
That's-
broader general definition or term.
Right.
Introduce concepts of mechanical ventilation.
Because
that's
it's
kind of what it says
concepts
in the
course
description anyway.
description. So, yeah, I just don't like the word initiate.
And I actually do teach it in this class as well, but not initiating, but the basics, the waveforms and what it all means and the settings, basic settings, just introducing, yeah,
I mean,
basic
learn best by
concepts.
repetition. You
Right.
do all the stuff in the lab. It's just like the first couple of weeks or month of 1410. We go over all of these things, oxygen mask, CPR, but they do it in the lab. They don't practice it. Mid-semester, they actually go out and do it on patients, but they practiced it in a lab a lot. So that's what this is a lot about. You should have a ramp-up period that they know the equipment extremely well, inside and out, before they allowed. If they mess it up a little bit, it's not a big outcome. But if you hook up a vent wrong because you've never twisted the knobs in lab, where if you twist it, it's not a big outcome. So introduction, I'd be good with that. I like the way that actually says.
With these courses that we're looking at, are these recommendations for community colleges throughout Texas? Are these the recommended courses? Is that what we're going to aim for, or is it
With the changes.
this page that we're looking at?
Right, these are the changes that this committee recommended at its last meeting.
And it would be recommended, not mandatory?
Well, no, these changes will be made into the WECM courses.
Okay. And then the course, the actual community college the program has the option to adopt or not. Is that going to be correct or no?
No, once it's changed in the WECM, that's the course that they'll have to use.
Okay.
I mean, whether or not they adopt the POS, they still
Okay.
have to adopt the changes that are made to these courses.
If you adopt those, and you're doing something different. Welcome description, sorry. If Welcome's description says one thing and you're doing something other,
No, I guess what I'm saying is if they teach this course, this is what they have to teach in the course.
okay, that's what I was saying.
And those schools that used to have fundamentals 1 and 2 now have to adopt procedures 1 and 2.
Right. As far as I know, anyone here teach both fundamentals and procedures?
Yes, we
One or
do.
the other? You teach
We
both?
do. We
All four?
teach fundamentals 1, 2, and procedures 2.
Okay, so
Same here.
You would be-
Yeah.
would you be able to find, because if procedures, fundamentals 1 and 2 are going to be archived or
So-
deleted, would there be another course that you would?
For us, we have to put intro back in. So that's why shifting a lot that was in fundamentals 1 now goes into intro. And then we're
Oh.
teaching more technical skills in procedures 1. I've had arguments with my faculty, so we're good.
Oh, okay, so you got to work.
I'm putting it in there.
I know it's hard work, but you got to work that out.
I gotta buy it. I gotta get them to buy in.
Thanks.
So
And when would this be proposed to go into effect? When would be the last?
Okay, and again, so this would probably go to I think the earliest it would be the April board. And you're given at least 1 year to make the changes. So this would probably be fall of 2020 before it
Okay.
becomes mandatory.
So we did agree for the procedures, respiratory care procedures, to use the word introduce mechanical ventilation instead of initiate.
Right? Introduce concepts of. Yeah. Right.
Okay.
So how do we want to, do we need set up equipment in there? Set up,
And that's why I guess you're given some flexibility. You can do the equipment, show and tell kind of thing. or
Okay,
you
set
can do
up
a little bit
equipment.
of, here's the equipment, play with it a little bit, like David was saying, we can twist knobs and everything like that to make sure it doesn't blow up or anything. So,
okay, so set up equipment, introduce concepts of mechanical ventilation.
right.
would that be in the description or the outcomes? Because the
That's-
description says concepts of mechanical ventilation.
Because
Right,
that
yeah,
doesn't,
she's-
that's not an outcome.
Well, she's reading the
Introduce isn't an
outcomes and set up
outcome.
equipment.
Yeah, so change initiate to introduce, which is kind of the same thing.
Right.
Yes.
Can introduce be an outcome, though?
Yeah,
That's true.
that's a question.
Yeah, introduce concepts.
That can be
Which
an
is-
outcome.
Are you saying because it's not measurable? Is that what you're asking?
Yeah.
Well, I think generally objectives are measurable, but I think outcomes are not as rigid. Right, when we do learning objectives, we should measure them and use that action vocabulary, action verbs.
Could we use communicate concepts of mechanical ventilation? Just like we got communicate relevant information to members of the healthcare team. Could we use that
That's
same
better.
wording, communicate relevant concepts of mechanical ventilation? I mean, does that make any sense?
The only thing that's comes to thought is communicate. We're communicating all of this. I don't know, everything we're
Right.
doing is a communication
And,
in some
well,
form.
remember that and of course, outcomes is what the student can do. So I guess to your point, can the student communicate? And that is something that you would measure. So,
Well, simulation labs are very almost all of the mannequins have compliance and resistance built into them now. So it would be very similar to being in an ICU, and the patient could respond equally well and even better than a real patient with the instructor controlling it. So they would be doing everything like ventilating in the lab. All of the different compliances or resistance, different diseases, all of those things could be made similar. So when they got out, they practiced. A lot of y'all may not have had driver's instructor where before your parents could drive, they had machines you would get in to drive. and you would drive on a film. It may be hard to believe, but in the 70s we did that. So you drove this thing around and got pretty good at not hitting things. And this would be similar to that.
How do we
Okay,
word
so-
it?
Just want to repeat the phrase. I'm not sure who mentioned that phrase. It starts to communicate concepts of.
Instead of
Not sure.
introduce, just put communicate concepts of mechanical ventilation.
It sounds more, yeah, measurable.
Did this mine. Communicate and practice on simulation.
Well, that sounds like we're getting into a lot more mechanical ventilation in
At the
fun-
end of this
in this
class, yeah.
course
Which process?
than what a lot of us do. We actually
Right.
have 2 mechanical ventilation courses, so we don't do a lot of mechanical vent in this course. We do introduce it by BiPAP, CPAP, but we don't do a lot of other invasive mechanical ventilation until we get to the mechanical vent courses.
Correct.
So how do we word it for what the student would be able to do? Understand? I don't know, that's not really
That's not
action
measurable.
But the end of course outcomes have to be what the student can do, right? Is that what? Student would introduce it. Student could do.
It might come back to the interpretation of what mechanical ventilation is, whether it's BiPAP, CPAP, or actually initiating mechanical ventilation, or invasive mechanical ventilation.
I mean, if you want to use a term that they could measure, you could say describe basic concepts of mechanical ventilation, or something like that. Describe, list, identify, words like that. If it's something that you want them to be able to produce and see, observe. So like list, identify, what else did I say?
Identify the need for mechanical ventilation?
Well, and I guess my only reluctance with that is I don't think we want to get too,
Technical.
I guess, fine-tuned, I guess you would say. I think.
Too narrow that there's
Too narrow.
no-
Yeah.
Yeah.
So I think, actually, the word I was thinking of was describe, that you said.
Describe concepts of
Concepts of-
mechanical ventilation. That's pretty vague.
I would be fine with describe.
Okay. It's pretty broad.
Does does that work for everybody?
Describe concepts of mechanical ventilation. Okay.
Okay.
Concepts. Vague.
Okay, was there anything on the cardiopulmonary anatomy and physiology, the second page? We kind of skipped that one. Are we good with what's there?
So we're just combining, if I remember correctly, the 1207 cardiopulmonary AMP and just actually kind of changing its name to advanced cardiopulmonary AMP? Okay,
Right. I mean, advanced already exists. So, yeah, we're just
Right.
combining those two.
And then the 1207 would be archived?
Right.
Okay.
Somebody had a comment they did not want to archive 1207.
It was somebody that was Cisco College that was teaching both of them.
Yeah, she was really wanting to not archive it, but I don't remember.
Our polysomn program uses that, 1207.
I'm
I
sorry.
think it was.
Our polysomnography program
Oh.
teaches that.
And, I mean, it's, another option is we can go ahead and leave it in the WECM, but just not put it in the program of
POS.
study.
Okay.
Yeah.
So
I agree.
other programs could use it.
That's nice. Yeah.
So in pharmacology, since we took the word basic out, do we take out the word basic in the course description? Just pharmacological principles and practices?
I agree.
I want to clarify on the last page, the cardiopulmonary diagnostics. I know we combined all three of those courses because they were but this isn't a required course in the program of study, correct? This was just housekeeping?
Right.
Okay, okay. Because, yeah, we had three courses that were kind of the same thing. Okay.
Okay, was there anything else on the course changes? Are we okay with those? Okay, I guess we can go to the next set of comments where, I guess what subcommittee members submitted after I sent out the minutes from the last meeting. And if we want to look over those. Okay, regarding the first, I guess, first comment from Kelly Reynolds about, I guess, 2210, 2353, 2130, and 2147. That's likely we're going to take out
I just think we
1141.
need to not require what semester they're in, because that gives everybody the flexibility of putting those in where they want. Because some of those might not be offered in the first, especially like exam prep wouldn't be offered in the first 3 semesters. I just think in the original document, it had it listed out first semester or semesters, and it's,
After mechanical vent.
yes, yes.
No delineation, so if you're looking at this, not being us, you would think we had to.
Yes.
Do we have to recommend at all that these courses be taught in a certain semester? I mean, we don't have
I
to,
don't think so.
correct?
Yeah, and the,
Except for mechanical
mean-
ventilation has to be taught by the end of the 3rd, we said, because if that was the natural time when people were to transfer after the, kind of the first year or the 3rd semester, they needed to at least have that class. And I'm assuming most places are going to teach the other ones before that, right, before, yeah. Wouldn't make a lot of sense, so.
okay, so I guess would it help if we just put mechanical ventilation at the end of the list?
No, I think, I just wanted to make sure that was clear, that it could, or that we were, that you were clear on that, and that when it got presented to the board, that this was all wide open.
Right, and yeah, and we don't prescribe the order or the
Okay,
sequence.
there's no, okay.
It's really just,
Yeah, we probably just need to note that in there, because I think that's where some of the confusion came from the public comments, is like, this all has to be done in this sequence, and there's no movement allowed, and that's not what our intent was.
Right.
Just a caveat to that, or thought, if we're trying to have students transfer, and we have acknowledged that students generally transfer after the first year, we did talk about last time having courses within the first 3 semesters that would be transferable, so they're not repeating courses. So just a thought from last time, I do agree with not putting an exact sequence, but be mindful, if the goal is to have transfer students, then we need to consider that as well. It's just a thought. That's what we talked about last time. And generally, I mean, that's when I see people wanting to transfer, is they have some classes the first year from military or from some other, I mean, it doesn't happen very often, but they've taken the first year some classes. I live in San Antonio, so we're a military city, so we're getting all these students from everywhere, but also we get nationally students from everywhere, so just because it's a military city. But
So would we want to say that through mechanical ventilation needs to be offered in the first 3 semesters?
And by first
Okay.
3 semesters, would we be meaning summer, fall, and spring, something like that? Fall, spring, or summer?
Yeah.
Right, that's what I'm,
but yeah,
Alright.
considering 3 semesters in a year, as a year.
okay.
Yeah, that's fine with me. I mean, that's kind of what I just was, because it just came as the one big list, and
So with mechanical ventilation up, needs to be within the first 3 semesters, and then the note on the mechanical ventilation, and then everything below that would just be whenever.
Whenever
We
you want it.
probably need to distinguish that somehow.
Throughout the program, throughout your 2 years of the program.
Just to make sure I understood that, so cardiopulmonary disease, we teach it in the 2nd semester, and that was recommended by our advisory committee. Is that saying that we cannot do that, or we have the flexibility to continue?
I don't think it's that we can't. I think it's, we have to have this up there, but you can put the others in there, I would think. But y'all are the committee. I'm just here.
I think some programs maybe teach cardiopulmonary disease a little later, And that's fine too, but yeah, we teach it early too. So I think it just means you have to do this much in the first 3 semesters. That's the way I interpret it. You have to do this in the first 3 semesters, but then you can add in whatever else you want, you know, with the rest of the courses, so.
Generally, when y'all teaching mechanical vent, is everyone pretty much starting in the spring, or when y'all start teaching?
Third semester.
So would that be summer?
It's fall. We start in January, so it'd be fall.
So the second year?
Yes.
We start
See,
ours.
Well, our class, I mean, we
in the
teach it in
fall.
procedures in the spring. That procedures course, we actually teach the basics, and then in the spring, so the second year, I'm sorry, the second year fall is when we teach mechanical vent. Okay, so same here. Okay,
So we teach ours in our second year fall.
yeah.
So
same
would
here.
that be, I mean, but we go summer, you know, fall, spring, summer, but it wouldn't be until the fall.
Same, yeah.
Ours would be like after the 5th semester.
Or fourth, right? Because you said fall.
Like,
So I have 2 starts. I have a summer start and a spring start.
Oh, okay.
So for us, we do initiation and procedures 2, and we do mechanical ventilation, more advanced stuff, 3rd semester. So whichever falls the 3rd semester.
Yeah, we have 2 starts. We start fall and spring. And but we do 2 mechanical vent courses in semesters 2 and 3? Yeah, 2 and 3.
By the end of the 3rd, they've had mechanical.
Right.
By itself, and then the program starts. We teach mechanical ventilation in 14 and 11, the end of that. So that's really their 3rd semester, but it's the second 14 and 11 towards the end of that. And we're smaller, we don't have that many ventilators to have access to. So if we wait a long time, there may be 2 days where we don't have any vents. If you're at a hospital that you've got any 20 vents you can pick, that makes it easier. But if you only have hospitals that have 3 vents, and some of those may not be there the day your students are there, that puts you a little bit more of a bind. And our groups are smaller, we only have 12, because we don't want to flood our smaller market. So we have more one-on-one time. So we can live with either thing. And for a long time, they didn't start till the 3rd semester, late in the 3rd semester, and our advisory board pushed us to push it higher so that they'd have a little more hands-on since we're limited. But we can just do the simulation stuff if that fits.
I sometimes look at it as, for those of us that have been in this forever, the CRTRT concept. So by the time I was a 1+1, and so I wanted students to have their basic knowledge by the end of that 3rd semester and function as a CRT. And maybe because that's what I came out of, but I want them to be able to run around like a CRT at that point.
Well, they don't hire any of ours anymore. Students don't get to work till they graduate with their RT now,
Well, that was way back in the day.
because there's not many jobs.
Way back in the day, we got hired as CRT.
Well, yeah, I
Yeah,
mean,
but
I took
in
the,
Houston, you can't get it without your RRT.
no,
Can't get a job.
no.
Okay, so I guess as long as we specify that it's not set to a sequence, I guess getting back to these 4 courses below mechanical ventilation, that as long as we explain that we're not specifying that these have to be after or at a certain time.
Just any time.
Right. Okay, and then Yes, next we have a Melody's comment about A and P.
Something that concerns me about her email is that basically, she says, we currently do not have the applicant pool to require those as prereqs. We actually have it in our program of study over here. I mean, would that, like, do her program in?
And I was hoping she would be here today.
I
but-
mean, that concerns me.
Cisco, that's up in Abilene.
And they're small.
So I think they take AMP1 and AMP2 during the program.
Can we just leave it as recommended prereqs instead of mandatory?
Well, and then rereading it again, it looks like what she's saying is that she doesn't want or would like to keep 1207.
Right, and we
decided
we
that
decided to do that.
So, and that's what I wanted to ask her is, if we keep 1207, does that satisfy her needs?
Well, it doesn't
wish
have to
she
be
was
part of the
here.
recommended program of study, but she could use that as another class if she wanted to, if we left it in Weckham,
Right,
It does
and
state,
that's,
if we're not going to archive it.
but it
right.
does say that AMP 1 and 2 are recommended to be general education courses for the program of study.
Yeah, number 2.
She's concerned about her students taking AMP 1 and 2 as part of the POS.
Right.
So do we need to not make those like mandatory general education courses, but
Recommended.
recommended?
Well, I think they take it, but I think it's just during the program. They just can't require
They
it
don't
as
want it as a prereq.
prereqs.
that's what I was reading.
Yeah,
Okay.
they still take it, but just not as a prereq.
We've never said.
So how it's written is
No,
okay
I think
for number 2.
her concern was if we deleted or archived 1207, then that would force her to teach them as prereqs.
Yes, that's what I thought too.
And I'll
Would
try to
there
get.
be any way we can look up her
Curriculum,
curriculum?
like we had last time, to see if they are.
So we
in
can make
fact taking
sure.
that later?
Like, Google it, you know?
I bet you we have the,
I don't want to do her in.
have every, we
By
have
any means.
I walked off and left it sitting on my desk.
For the, I mean, not the AMP, but
Okay, yeah, she,
I teach physics, but it's the advanced.
Yeah.
yes, 1207 in the first semester, and then 2401 also in the first.
So she's
so she's
requiring
teaching-
2401.
2401 and 1207 at the same time,
And does she do
Is she-
2402?
and 2402 in the second semester.
Okay, so she is teaching it, just not as a prereq.
Right.
So if
it
we
looks
just
like that
recommend
would-
that it be within the program at some point, not necessarily
So just,
recommended as a prereq, but
but do we have it as a prereq, like you were saying?
It just says
general ed.
general ed.
So she should be covered.
So
then.
she's
It
good,
does
yeah.
say As a prereq.
Right, there it might have been, as we were discussing it, a lot of you said
Maybe so.
you use it as a gatekeeper course,
I think that was in the conversation
and that
last
might have
time.
been what she was picking up on, that,
She doesn't need a gatekeeper.
so as long as, yes, I think as long as we explain to her that it's not necessarily a prereq.
If we have a class, it's anatomy, it's a combined anatomy and physiology, it's called 2407, and so it's 4 hours of A&P. We take that as a substitute for 1 and 2. Would we still be able to do that?
Yeah, we talked about,
Oh, well, because that changes, would we still be able to do that?
so
It's really,
if your student who took 2404.
yeah,
If
24,
your
I'm
student
sorry.
goes to one of the other
Right.
colleges, they would have to take
Right, it again, 1 and 2.
Or
Yeah,
some kind of catch-up.
okay. We do recommend them to take 1 and 2 so they can get a bachelor's degree. But sometimes for just getting in the program, they just take it over the summer, or they just want to take, they don't want a degree higher than associates, they just want to take one course. So they would have to take 1 and 2? Is that what it'd
If
be?
they went to another,
Institution, but we could continue to take 2404 if we wanted to?
right.
Okay.
That being said, if one of her students who had had the 2404 wanted to come to my program, and I was okay with substituting 2404 for 1 and 2, would I be able to do that? My school wouldn't let me, right?
Because of the hours.
Hours, yeah, that's what I was thinking.
Yeah, at our school, we accept either one. If you take the
Right.
2, because we compete with nurses sometimes, if they don't, they come running to us. Y'all know that. But we take both their scores and average them. And I'd say, is anatomy a problem? No. Are you planning on going on? Yes. We'll take 401 and 402 and we'll average that. And the same way with math. We take 1332 or 1314. If you're planning on going on to college degree, take 1314, because that'll move you forward.
So Erica, this is okay?
Yeah, that sounds good. Yes. Thank you.
So we're leaving 1207 or 1307 as a WECM course? Okay.
Okay, next was Don's comment. And I think he, on the back of the page, made some recommendations for
Yeah, I just got some feedback from colleagues saying that they felt like this was an all-inclusive list. I don't think they misunderstood that this is just parts of the WECM that we're making adjustments to, and that the rest of the WECM courses would not be affected.
Right, and I
Right.
think in the updated curriculum, it does show additional courses determined by college, which was 20 to 35 hours.
Yes.
So that would hopefully,
And then the other the comments were, it appeared that we were only going to have 2 practicums, or practicals, however you want to look at it, 2 clinicals.
right.
When we all know we do a lot more than that. So I think that was the misunderstanding as far as the wording was concerned to a lot of people. That's the feedback I got, personally.
Okay, so as long as they know that there are additional, but just that these are the 2.
Now, I definitely think it made more sense to us since we'd been here, but the people that weren't here.
Oh, yeah.
Right.
Right, exactly.
Like, what did you guys do?
And we've all kind of come to grips the fact that this is going to happen, and if you haven't been to these meetings, you would be like, what? I mean,
Why are they
why are
doing
we
that?
doing this? Yes, who decided on this? So, a little time.
So that was all corrected. So
And
now we
then
just have to do
Araceli-
the rehab, home care rehab.
So you mentioned the
So my,
home,
yeah, my main concern was not recalling agreeing to the home care rehab.
and it's entirely possible when I was taking my notes that I might have missed, we had them on the list and then I neglected to take it off. So are we agreeing that respiratory home care should be left up to the additional courses and not part of the,
Extra credit.
Yes, I
Be a separate
don't
course.
think it needs to be a POS.
okay. And I remember for the discussion, specialties is kind of a catch-all. Is that still
It's kind
Valid.
of still a catch-all.
right, I mean, is it still valid to have it as the POS, or would that be
It doesn't have to be.
I don't think it needs to be a part of the POS.
would that be additional courses?
Yes.
Okay.
Specialties and the rehab, not making them part of the POS, just part of the additional courses that are required, like under here.
In other words, they could still teach it, but it's not.
Yeah, it's not
Right.
required.
It doesn't have to be in part of the program of study.
We won't make everybody teach them. Take those two off.
I mean, right now, I don't think anybody's, from what it sounded like, everybody's specialties was a little bit,
Special.
and it may just need to stay that way.
Very much, whatever you didn't get taught.
Something you need, but you can't quite define.
And I guess, since we're going down this rabbit hole anyway, I kind of had a question about exam prep. I mean, I imagine it's in all of your programs, but considering if somebody took exam prep at another college and then came to your college, you would give them credit for that exam prep.
I would actually rather them sit through another course with us.
And that, I guess that's what I was getting at. So should that come off the list of transfer? I mean, I say you can still have it in your program, but just
I
not.
would say yes.
Yeah, I mean, I assume everybody teaches that in the final semester.
Yes.
So they're not going to be able to transfer in and graduate from our college at that point anyway.
Right, because they wouldn't have the
Have enough courses at our college.
residency, yeah.
So take it off the.
I
POS.
agree. That could go.
I think at this point, we were just trying
Okay.
to look like we were
Yeah.
making up some hours for the second year. But if we don't have to, then.
And then any other,
I mean, I think that leaves us with really a pretty nice core of courses there that, really covers what everybody probably needs to do, and then still gives us the flexibility to teach some of the things that we like to for our certain geographical areas.
certainly, yeah.
Does-
That- I'm sorry, I was just going to say, and that kind of is more the concept, I guess, of the program of study is these are the courses that all colleges pretty much teach, and then still allow flexibility for the local courses.
With this neonatal pediatric cardiopulmonary care, is in the actual objectives, is that actually mechanical ventilation also? Or, I don't,
Oh, in the course description?
in the actual course description.
I'm sorry, I didn't print out this packet again, but
I don't, I'm sure it's in that scary thing that I brought.
Because we teach pediatric mechanical ventilation, and then we teach the neo stuff, I mean, the neo-ped stuff, like, in the very beginning.
okay. So the outcomes is describe fetal development and transition to extrauterine life, assess maternal and fetal history, modify therapy to neonatal pediatric patients, describe the etiology, pathophysiology, clinical manifestations, and management of neonatal pediatric disorders, and analyze, interpret, and apply patient data in selected patient care settings. So it doesn't specify.
So we could actually teach like neo-ped vent in here and not just have a neo-ped class. Neo-ped vent, okay, okay,
Yeah, it doesn't
fine with that.
specify it, but it's broad enough that you can include it.
Because it's management of those disorders
Right,
with the ventilator.
okay.
Okay, and so does that address all of your concerns, Araceli? Okay. And then finally, we have Marby Ruth McKinney from Alvin. Okay, those are general procedural questions, if they go to baccalaureate or, okay, and I did reply to her. Okay, does anyone else think of anything else that's maybe come to mind since the last meeting? I think, next we'll probably look into the public comments. Might want to take a 10-minute break before that. But I just want to see if there were any other issues or concerns any of you guys had since our last meeting. Let's see if we can address them as they come up. So I'm going to go ahead and call a break.
We're going to take a break. Please be back by 11:20. Okay, it's 11:20. Let's call the meeting back to order, please.
Okay, now if you want to maybe glance through go through the public comments, and some of them might have already been addressed with what we discussed earlier, but
I think the first one we have addressed already.
okay. Yeah, it looks like they were using the mechanical ventilation as an outcome in another course, and they were asking if it needed to be a separate course. And I guess the solution there is to put outcomes, to teach the mechanical ventilation as a separate course, and yeah, right.
Right, and with the rewording of that concepts, right. I think that might help explain that better, yes.
Even when they're saying, shouldn't mechanical ventilation be removed from the procedures to, oh, okay, description, but that's not what
Right. We
have, or is it? Because it,
It said initiate, and we changed the wording so that hopefully will.
so in procedures 2, that's the one that we changed
so they
to
could just be
describe
general.
the concepts of mechanical ventilation. So it can be just a
Broad.
visual, broad, yeah, instead of a actual practice.
Okay.
I mean,
Principles are taught in 2314, which is a mechanical ventilation class. And then you put those principles hand to eye in one of the procedure courses. Is that right?
We're just going to describe.
Opposite.
so you describe it in the procedures
We describe it
course.
in the procedures because that's where you have lung expansion and all that, but then in actual mechanical vent, 2314, you would actually do the hands-on, this is where you learn it all.
Okay.
And some people do you do 2 vent class, I just do 1, but then you could do another advanced vent class as well, but I think your initial vent class would be the application, right? Is that? Forget about the mic, sorry.
Okay, and Cisco College, number 2, that's the one we talked about.
Yeah, we addressed that.
Okay, Amarillo College again. I think the confusion there again was that the program only showed up to 46 hours.
Right.
And she wanted to make sure that we had kept it at the 66. Okay, number 3 is okay, yeah, those have all been addressed. So number 4, Northwest Texas, Amarillo again.
So have these facilities been contacted at all, and that made these comments to let them know that this is not really the problem they think it is?
They haven't been contacted yet, but
Okay.
we will. Okay. Yeah, but Amarillo sent about 5 or 6 comments. So, yeah. Okay, number 6.
On number 5, from the Amarillo, basically it says, my proposal would be to allow the inclusion of 2402 or 1307. Well, we're not excluding that, but we're requiring 2402.
We're recommending 2402.
Well, yeah, if it's in
Thank
the,
you.
if it's on the POS, then it's
That's right,
required.
yeah.
I can understand her comments a little bit. I had a student from her school contact me and wanted to maybe transfer to my school, but she hadn't started her program yet. She'd been accepted to Amarillo's program and was wondering if she could come into my program. And I already had my student set. My program was starting in 3 weeks. So I was like, send me your, she already had a bachelor's degree in something else. So I just told her to send, but Amarillo does not require the 2 biologies, and I require them as a prereq. So this is not in place yet, and if it is in place, would I have to accept her student? That did bring up a lot of questions for me. I'm like, okay.
I haven't seen anything that says that we have to accept the transfer. The only thing I've seen was that if we accept the transfer, we have to complete them within the 2 years and based on the curriculum they were at the original school.
So I was okay to not accept, like I said, she hadn't even started the Amarillo program yet.
She was really just coming to yours.
Right, she would have had to been accepted into mine. Like I said, I already had my student set for the fall, and it was 3 weeks before school started, so I it did bring up a lot of questions. I was like, okay, do I have to accept her? You know, I agree that we are trying to make it easier for students to transfer, and most likely she would have been a good student. I mean, she already had a bachelor's in a health-related field. So I could have made a case to accept her there again if it had been a little earlier in the summer. But I was curious how to handle that, so.
We can still require any transfers to meet the same requirements we would somebody who's applying to start the program.
That's what I was, because I had told other students that they didn't have the prereqs and they couldn't come in. So I didn't feel like it was fair to let her in without having completed everything the other ones needed as well.
It does get confusing. The same thing about Erica's, the A&P course that her school accepts, our school doesn't accept those at all. So we don't take that at all. Yeah, they would have to retake it.
And that's kind of the same, and Amarillo College doesn't require. A lot of the rest.
241.
No, they only had 2401, which a lot of the respiratory stuff is covered in 2402.
Yeah,
So,
and you can't take 242 by itself.
right. She could have taken it at my school. She still can, but she didn't send me her transcripts or follow up.
Okay, so does that mean if we keep the anatomy and physiology 1 and 2 in our program of study, will that negatively affect Amarillo? It would, correct?
It will mean that they have to require 2402, yeah. Y'all don't require it either?
It's recommended that we require 2404, the specialized A&P,
Got it.
and if they're in a hurry to try to get into the program.
But didn't we say we would accept 2404? Isn't that what we were just, that Erica was asking before, is that wouldn't we accept if the college accepts 2404?
Right, I believe the discussion was that if the college could agree to accept 2404.
So if the college teaches it and it can accept it, or once chooses to accept it, they can. So I could keep my 2404 as is, and that won't be affected, right? I think is what they see. I think there was no affection. Well, from what we talked about, there shouldn't be a change. I shouldn't be concerned about it. But now I'm thinking, wait.
Because if you take
Because
2404, then
that would
why should you
change-
have to change to
Right.
2401 and 2402?
But then if I take, because 2404 is my, included in the curriculum, then that, if I do 1 and 2, then I'm going to have to delete one of my respiratory courses.
Right.
So that's where it's going to affect,
And-
if
and-
not anything else.
Yep, and that's where we're at.
I mean, we know the majority of us all have this A&P in there. I mean, and we know it needs to be, but does it actually need to be, like, written? I'm just curious. I
Or could we
mean,
just say 2401 and that's it?
2402 or 2404? Or
Only thing I can think is if your college doesn't have 2404, which mine
Right.
doesn't,
Well,
then
then
they
so
would
we
have to
wouldn't
have
teach it.
1 and 2, right? Mm-hmm. Is that right? Because
we don't
in
have it
order to
either.
get my right amount of hours for my student,
The only
it'd be
thing,
3 hours shy.
well, if you said 2404, and if it's in the, would that be managed? Okay, so just be an option. If we just added the 24 for just an option,
not as heavy
or is that
duty.
too confusing?
Well,
Or could we
that's-
just say 2401?
Well, all of ours are ultrasound, rad tech, pharmacy, all of those take just 2404. And I've had them that come both ways because they want to do 01 and 02. And really, when you get them into our advanced cardio 1340, neither one are better served. neither one of them come with the knowledge that needs. We have to teach that to them. They don't come understanding how the heart pushes oxygen through. I mean, they learn about how the cell works and a bunch of stuff that is pretty much useless. I've spent time talking to the biology people, and they're great people, but they say this is not what we're supposed to teach. So
That's the same for our college. They're not prepared to, we have to teach them everything from the beginning. Yeah.
it's kind of a
The
waste.
problem is that you guys will take 2401 and 2402. Your colleges would accept that, correct?
Yeah,
But
ours
our
take-
colleges won't, a lot of colleges won't accept the 2404. Am I understanding that correctly?
Right, mine wouldn't.
Yeah.
Well,
Right,
you
right.
counsel them, and if they say that's what they want, you tell them, take this. And, if you got time, students show up one semester before they start. I've got to get in this. I'm changing my life. You say, well, you take the 2404, but during the summer, if you get a break, take those, because that's what you're going to need if you want to go up. If they come to you early enough, which most students don't, but if they do, you say, look, first thing, you're going to get a bachelor? Yeah, well, then take these things. And you've got time, go ahead and knock those out. But how many, I have very few go on and finish a bachelor's. Do a lot of y'all have?
We have a bunch.
Have a bunch.
Well, of course it is.
Unless
And
they
it
already
should
have a
be.
bachelor's and it's not a waste of time, or if they just don't care. They know, some of my students know that they're going to stop at associates. I'd say only a handful probably go, or maybe a third gone to get a bachelor's,
Yeah.
at this point at least.
The guys I teach, when I see graduation, these guys are the first ever since the beginning of Adam that they're the first to ever have a college degree. The first. No mom, no dad, no cousin, no brother, no sister, no aunt, no uncle. They're the first. So surely they'll go to, and we push them to go to that. But it's like 150 miles to the closest bachelor that has anything to do with RT.
Online now.
Hmm?
There's several online.
Yeah, they're online, but they're pretty expensive. Most of these have been working at McDonald's, so they're looking to go from $7.80 an hour to $16.80 an hour. And they get caught in that.
Barrier.
Yeah, Another option.
But it'll change.
Another option for the subcommittee, I mean, if we don't recommend these A and P in the program of study, then it's really left up to each individual program to decide which to teach and which to accept and transfer. And,
That decreases transferability, though,
well, I mean,
quite a bit. I mean, that kind of negates the purpose of it a little
Yeah.
bit. But
Because if you don't take 2404 and they want to move, then they'll have to take the other before they can get in.
it isn't just us that won't accept 20, our college won't accept 24.
No, they won't. Nobody will transfer 2404.
I don't think we should be watering down the requirements just to try to make sure that everybody's included in this. What is really needed is what we're putting down here, and I think we argued this pretty in much detail the last two meetings and agreed that, A&P 1 and 2 may differ a little bit from campus to campus, but that basic knowledge is needed, and it will transfer to the baccalaureate degree. And even when I teach pharmacology, just for the basic course for our college, if they haven't had A&P 1 and 2, they struggle. I can tell you that from 20 plus years of experience. And I don't think our knowledge base for respiratory professionals should be watered down at all, and those are basic building blocks that they need.
I agree with you. It's just that if we do that, we've got to knock out an RT course. So that's the trade-off.
Well, you don't have to take out a whole course. You can take an hour
An
out
hour,
of each.
right.
That's what we did.
That's what I did too.
Maybe. That may be a way to do it.
Drop my farm from a 3 to a 2, things like that.
That's reasonable. A big step is made up of a lot of little steps.
Victoria College.
I'm sorry.
Okay, so as a group, we understand the need to keep that as is, but we feel that we need to make it 2401 and 2402 and leave biology as it is, as we've written so far. Is that what we're agreeing to?
Yeah, I'd say that would probably do it.
Okay.
And then number 6.
I don't know where we are.
6.
Where does it say six?
Yeah, nursing doesn't
Oh.
have a 13, 14 math.
That's true.
They have some little basic, so I guess that's to their math.
Yeah, if I have nursing that wants to come to me, they have to take 13, 14 before they can come to me. I'm like, and I think they wish they had it. They can't fit it in certainly an LVN curriculum, but,
So that's how they handle it.
but they have to do so much tutoring. that I'm glad I make them take math.
No, it's a balance.
Yeah. For 6, he just needs some clarification on how the program of study works.
I believe so.
So maybe I'm reading this wrong. On our clinical practicum 1 and 2, do we say how many hours it had to be?
Give it a range of,
Yeah,
Range of
1 to 3, right? So
Yeah,
that
we
should
were
cover
just-
her question, right?
Yeah, we
Okay.
think that she misunderstood, thinking
Okay.
that we're saying it has to be done in 2
Okay,
practicums,
okay. I was making sure.
clinicals.
Had a conversation with the program director at Victoria College. So he's like, oh.
so,
Yeah, he does. Actually,
okay, number 8. And this might have been the same thing
Same.
we talked about earlier. Okay. Number 9 from Alvin.
I also had a conversation with the program director at Alvin. She better understands it.
Okay, so,
She was playing with her curriculum over the phone with me, and I was like, yeah, so that's what you can do. I was like, it's a framework. It's not.
okay. So we're good there. Nine,
Yeah.
yeah. Number 10 from Houston, I think. I think that
Yeah, we took that out, so, right?
just, right.
Taken care of.
Yeah. As I was going through these, so we had like 5, I guess about 3 or 4. I think we had about 5 programs of study that went out at the same time for comments. Most of them just got 1 or 2, maybe at the most 4. This is the only one that got more than I mean, it's got 11, so. I think a lot of it is, like you're saying, you would have, let's everybody write the same, you know, to give us a strength in numbers. But I think we've addressed all of those concerns now. Again, in the last few pages were just a follow-up. I guess we talked about Don's comments. Jonas. I think that's, yeah, taken care of. I know, it was,
your name too.
it was way back beginning of summer. Yeah.
Why did I say no on that one?
I read it, and I was like, oh.
Okay, so with these, I'll go ahead and compile all our responses and send them out, I guess, for one final review from everybody, make sure we're all in agreement. And a lot of it is just mainly explaining, like you say, the concept of the program of study, and that it's not all of the courses, that they have some flexibility.
I did have another comment. I had another student approach me about coming to my program from another program, and he had failed a class, and he talked to me too late to start mine. But Temple College had made him take a test. That's another option. You know, I thought that was a great idea, and I wish I had thought of that before he could be accepted into their program as a transfer, because it would have been the last. Well, it would have been the last 2 semesters, and they made him take a test over all the information he should have already known, and he did not pass that test. And so I was like, that's probably a good idea, because there are such differences across the state, and the rigor should be the same, but it may be a little different, you know. So I guess I just wanted to throw that out there. That could also be another idea.
Kind of an assessment.
Yeah, just an assessment to make sure, because he had been out a semester as well, that his skills were where they needed them to be to accept him into their program. So that's acceptable, right? I mean, that would be an option we would have.
We also have, at least tell our students we're going to do that to them. So if they fail one course and they want to wait and come back another year and they don't want to repeat courses, we tell them that we can offer some kind of comprehensive lab measurement or test, and then that usually freaks them out. And usually I sit with them, I'm like, okay, what's the FiO2 for this device, and what's the, tell me about ABG, and then they're like, okay, I don't remember from a year ago, I want to start. You're telling me you're ready to start a year later, but you don't remember procedures 1, some of the basic stuff, and that kind of freaks them out. And usually that's more with the students, and I'm like, you really shouldn't be in this program, and you've already failed, and I just don't see success, and maybe some other reasons, personal professionalism and stuff like that, so.
Yeah.
No, I think that's a good idea for each individual program to have, an entry and reentry policy for things like that, so.
If you want to come back the next year, you have to prove to me all the skills you've already done, and, you have to be able to take the finals in those classes you already passed to prove to me you still have this knowledge. A year is a long time, so, yeah, same thing. We don't have it too much. Oh, yeah.
Because a lot of times it is.
That was my concern too. I was like,
Okay.
About that.
I guess basically we've done everything we needed to do today. So is there any other questions? We do have lunch over here, some sandwiches and chips. And you're welcome to stay or take it on the road with you if you like, but we're open till 5, basically. So, yeah.
So we're gonna get out early, is what you're saying.
So you're going to compile and send out via email what we've discussed, and then we'll go from there? So really no need to discuss another date for another meeting?
Right.
Okay.
The only, I'm always talking about contingencies, but the only situation I could think of is if so this, after I send it out to you and you say it's okay or send me corrections, then I'll send it to the advisory committee. And if they say okay, then we'll just go ahead and send it to the board. If the advisory committee has any questions, again, that's a very rare occasion. It might require another meeting here. Very slim chance of that, but just in case. But other than that, we're pretty much done. Like we said, we don't really have a schedule for, I think maybe after 1 or 2 years, we might want to call people back together. We'll check with you first and see if you want to serve again, but we'll probably convene another subcommittee group to look at how the program of study has been going and if there are any changes that need to be made. So I guess up till then, we're.
So would you say it's? I know we have a deadline coming up in like,
Right.
if we want to make changes. It'll be fall 19.
Right, I mean, the changes will go into the WACM probably this year, but they're not required until 2020. So they're available for,
I'd like to be a little more
That's a,
sure.
substantive for me.
that's a good point, because for our curriculum committee, we have to make changes a year in advance to put it in for the next academic year, so that's a good point to bring up. And maybe even put it in, well, I mean, I think everyone should be maybe aware, program directors, if they have that kind of stipulation at their college.
Yeah. I mean,
A heads up or something.
yeah, it has to go to the county.
Yeah, catalog changes.
Yeah,
Catalog changes.
huh,
And
that's a good point.
I'm just trying to, this one's going to be substantive for me. Like, I have to turn it in co-arc. So,
Oh, well, yeah.
yeah.
Right.
Yeah.
Okay, well, if there is nothing else, as co-chair, I'm going to adjourn this meeting.